here because it's 79 degrees outside and we'd rather be someplace else. And so we want to learn how to keep ourselves healthy, right? And so I'll tell you something here. Most of you are patients, some of you are not. I'm going to give you an opportunity to become a patient because I think you're missing out on a big part of your health, because these people over here, most of your patients, they're enjoying good general overall health because of coming here. So I'm going to give you an opportunity to become a new patient after by doing a free consultation. You know, most chiropractors or doctors won't do a consultation for free. You know, they'll charge you for it. They won't say it's a free consultation. I did this lady I saw yesterday, I was pretty booked all day. And probably she had neck surgery in 2006, and she is just in misery. She's been going everywhere, and she called here. I don't know how she got my number. Somehow she got my number. And so I couldn't see her till 1:45, and I spent a half hour just checking her out. And she had all kinds of stuff, and she was almost in tears. She was so happy to be here. So she's coming on Monday and going to do a complete exam. I didn't charge her anything, because I want to tell her what's going on with her. So the ones who aren't patients here, I'll explain why you should be here, because we're going to learn how to fix your wrist, but it's way more than that, because I'm going to show you this chart. I'm sure the ones who've been to this workshop have seen this chart, how the nerves are hooked up to your organs and glands, and when there's a bone out of place, it interferes with the impulses from the brain to the spinal cord into that organ. And so the thing with these misalignments, you could have a bone out of place in your neck or back, and you know what, 90% of the time, you're not going to have any pain, because that nerve root is not sensitive to pain. 90% of it's not. So you could be walking around with constipation or sore throat or earache or loss of hearing, which I'm going to talk about in a second here, and you'll never get the connection with your spine. And so when you see this chart, you can say, yeah, you know what, that kind of makes sense. Sure, I can see how that's all hooked up. That makes logical sense, doesn't it? Well, then you might say, well, gosh, can you give me some proof? Well, I can give you a proof, all right. Here's a general public statistic. 1/3 of the United States will die of a heart attack. Wow. That's just not my opinion. It's a public figure. That's a lot of people at a young age. How many of you heard of people dying of a heart attack that are supposed to be healthy? I mean, drop dead. And so that's not normal. I've been practicing for 32 years. How many people died under my care with a heart attack? 0. Same thing with cancer. And so these are things. I'm not saying that you have the cure for cancer, but I think the best chance of staying healthy, these people are here because they want to know more about their health. It's a beautiful day out. Most people would rather be at the beach, but you're here, and I have to commend you for that. So you can say, yeah, that sounds good, a cancer, heart attack, but I want more proof. Well, here's a testimonial with a signature on it. Now, I've been practicing for many years, and I've got hundreds and hundreds and hundreds of testimonials. I've never had one laminated. I've had pictures and roses and, you know, chocolates and all kinds of stuff, never laminated. And this is what this lady said. I'm telling you, this is really amazing stuff. She came in here, giant impact on my life. I have no more pain. I also received a little bonus while under your care. I have this hearing in my left ear restored. I was told many years ago that I had a 40% hearing loss in my left ear. It was nerve damage. Now, she didn't even tell me about this. She really didn't. And then here's what she said. Then there was nothing they can do about it. Then after one of my treatments, I restored sounds louder, so I plugged up my right ear, and I can hear it, and I was excited. Hearing loss. Isn't that neat? You and your staff are still doing miraculous things. Thanks for taking care of my life. I would like to also add a great group of assistants you have that represent your office. Yeah, they're great, aren't they? A hand for my staff here. So am I saying I have the cure for hearing loss? No, not necessarily. All I'm saying is, if you want to be healthy, you need to be here. That's all I'm trying to say. So what we're going to do here, I'll show you, explain what we're doing as an agenda here. We're going to show you this wrist thing here. And this is my idea, because I'm showing this new idea with patients here. This is nothing I heard of. I thought this up myself. We're going to show you how to realign your wrist. And I thought I'd do this because a lot of you people are on the computer all day. And you know, I've done this on myself. I was doing some push-ups this morning. I put my feet up on the bar, and I kind of do this. I was doing some push-ups, and I get to my right wrist. I've done this to myself probably 4 times. And my right wrist felt really loose. So I did it to my left. So it's a thing you can do, and then they feel really nice. So this is something you can do on yourselves, anytime, anywhere. Now, some of you have been to my foot workshop a few months ago. Now, to determine if a joint is out of alignment, what do? You remember what you do? You pound on it. So if you pound on your foot, and if there's a bone out of place, just one bone or more than one, a muscle that was previously strong will go weak. All that tells you is there's something wrong with that foot. But we're going to do the same idea to the wrist. We're going to pound on the wrist. Now, by the way, the wrist is a lot smaller than the foot, so you don't have to pound on it, you just tap on it. If there's a bone out of place in your wrist, you'll go weak. And I thought I mentioned this too. I thought of this traction you're going to be doing to your wrist and using your cerebral spinal fluid in your body. The cranial bones, the brain pumps this thing called CSF, cerebral spinal fluid. It's in every cell of your body. So you're going to use that to your advantage. So you can really make a great correction. And because of that, you'll do a range of motion before and after, and actually, because you actually fixed your wrist, it's actually going to help your back. It's pretty amazing stuff. So here's the agenda. What we're going to do is I'm going to pick a volunteer that I'm going to volunteer myself. I'm going to do the demonstration, and then you're going to pair up and do it on each other, and then switch, and then you can do it on each other. So you both know everyone knows how to do it. And then I'll explain at the end how you can do it on yourself. I mean, you can kind of figure this is not a difficult thing. But this is exciting because if you have any pressure on your median nerve, any kind of carpal tunnel, any kind of tendonitis, this will actually help, like a lot. I mean, it's something you can do anytime, anywhere, any place. And by the way, when you do this, you always need to be standing up, not sitting down, because again, you're using your cerebral spinal fluid, your spinal cord. That's how it gets to the wrist. So you want to stand up and do it, because if you sit down, your spinal cord is kind of crinkled. You want to be all elongated as much as you can. That's why the breathing you're going to be doing in a couple of seconds here, that enhances the correction you're going to get. So here's what we're going to do. We're going to get everyone to stand up. You're going to cross your arms. I'm going to see who's got the most restricted range of motion. Are you nervous? Okay. So everyone twist to the left. And twist to the right. Rosemary! Okay, tag, you're it. Okay. Now hopefully you have a strong arm. I don't know if you have a strong arm, but if you have a weak arm, we'll do that too. Let's have your arm up, and you push up towards the ceiling and go. Surprisingly strong, isn't it? How's that possible?
Especially since I've been here for a week.
How about your left arm? Now push hard and go. Oh, that one's weak. That's interesting. So you have one weak arm, one strong arm. Okay. Okay, so let's cross your arms. Remember that show, A Dream of Jane? Stuck in the 60s again. Let me go over here so you can see, because we're on YouTube here. Hello, YouTube. By the way, it's 79 degrees in Redondo Beach. What's that in Celsius? I don't know, about 26?
26 or 7.
27, yeah. Okay, let's twist to the left. And then twist to the right. Which way does Rosemary have a restriction to the left or to the right?
Left.
Yeah, it seems like to the left, yeah. It seems to go further to the right. Okay, so it's a very easy thing. You have an arm. By the way, if you're a strong guy, don't you look like you're pretty strong? And Maria, well, she's smaller than you, so probably when you're testing Vince, it's Vince, right?
Vince, yes.
You'd probably want to have him sit to do the muscle test, but stand to do the correction.
Okay.
Because sometimes, guys are big, it's a contest. It's not a contest. Your arm's either going to go strong or weak. It's not a thing. So hold out your arm here, push hard and go. So I don't know if, typically it's the dominant hand that's going to have the wrist. If you're on the computer, you probably have more, but not necessarily. You can have them both. So all you're going to do is you're going to go ahead and stick out your arm, push hard, and you're going to tap on the wrist to see if there's a misalignment in that right wrist. And if there is, that right arm will go temporarily weak. That's all you gotta do. And push straight up toward the ceiling and go. And you do go weak. Now it comes back in a few seconds. 3, 2, 1, and push hard and go. Now if I do it to the left arm that's already weak, what do you think is going to happen to the strength of the arm if there's a problem there? It's going to go strong. You guys are too smart! Okay. Probably move the wrist, because if I bang on the watch, I might hurt. No, we're just going to get up. Yeah, maybe you should, I guess. Is that my tip?
You really want it? I don't know how it's going to look on you.
Is it a Timex? So we know this arm is weak. Now let's see if we tap on it, does it become strong? I have no idea. Push hard and go. Oh, it does! Look at that, just the opposite. Oh, we're going to have a fun day here. I didn't expect this. I should have. And of course, then it goes back to being what? Weak? It does. So what you're going to be doing is...
It means both of her wrists are bad.
Yes. It's kind of confusing because the left arm is weak. It would be a lot easier if they were both strong, but that's in a perfect world. You know, it doesn't always work that way. So what you have to do a few things all at the same time. You're going to be wiggling the wrist around just to get the proprioceptions going. And then you can take a breath in and breathe out. You're pulling, then you do this again. You're rolling it around, back and forth, sideways. Get some proprioceptive fibers firing up. Take a breath in and breathe out. And you pull fairly hard. I mean, you don't yank on it. Okay, keep doing this. Take a breath in and breathe out. You probably do it 5 or 6 times.
You pull when she's breathing in?
Correct. You do those 2 things simultaneously. Breathe in and breathe out. And you're getting all that cerebral spinal fluid into that arm. You really are. Breathe in. I can feel it loosening up, by the way. And one more time. Breathe in and breathe out. We're not really pulling on the thumb. You have arthritis in that joint there? Mm-hmm. Yeah, we're kind of pulling on the wrist. So you're a pretty big guy, so I probably, don't put your hand, don't grip the thumb too hard. Just it's always on the wrist. I mean, you're not really fixing the thumb, just the 2 bones in there.
So it doesn't really affect the area?
It shouldn't. If anything, it'll probably make it feel better because you're getting more cerebral spinal fluid in that area. Yeah, it'll probably feel better. So same thing here. We're going to go ahead and wiggle the hand around, up and down, sideways, and breathe in. I mean, if you do this once, you'll know how to do this. And always wiggle it around before each breath in. Breathe in and breathe out. And this is really a nice thing. Breathe in. I don't know if I've done anybody's wrist. Have I adjusted anybody's wrist here? It's similar, isn't it? Yeah. Breathe in. Okay. A couple more times. Breathe in. And breathe out. And one more time. Breathe in. And breathe out. Good. Now, let's do this. Let's recheck everything. Push. This arm was strong to begin with, if you recall. Push hard and go. You pound on the wrist. Pound, just tap on it. Push hard and go. Try again, push hard. Okay, now that's strong. Let's try the other arm. That was weak. It should be strong, shouldn't it? Push hard and go. Well. You pound on the wrist. Is that pretty hard? Push hard and go. Good. Let's cross your arms. And for the moment of truth, which way was Rosemary restricted to the left? Correct. That is significantly better, isn't it? Actually, both ways.
Wow.
Wow. And for Rosemary.